Hello, my name is Dr. Brian Zanghi. I am a senior research nutritionist from Nestle Purina. Thank you for coming to listen to the presentation today. Today's topic is going to be on nutritional or dietary management approaches for dogs. It's going to include information across the entire lifespan, from puppy and senior, and we'll also be talking about some of the research associated with canine epilepsy. So the focus of the presentation, where it's going to be on nutrition for the brain. One of the things that we like to focus on with regards to puppy brain development is the use of omega-3 fatty acids, and in particular, the nutritional delivery of DHA and omega-3s specifically. So we use DHA as a key nutrient in the formulation of puppy foods because of its importance for brain development, particularly because dogs have such a minimal ability to synthesize DHA and also EPA. But because DHA is such an important nutrient found in neuronal tissue, so we found that through the different canine research that it's critical for not only learning, but also for vision. And so I'm going to be presenting some of the vision research that we've conducted previously to show the importance of DHA enrichment in diets associated with vision development. Now, puppies will receive DHA from mother's milk while they're nursing, but it's important to remember that DHA in particular will only be synthesized by the puppy for a very short period of time, up until they're about 3 to 4 months of age. And then that ability to synthesize DHA naturally goes away. And so then they really must rely on the delivery or ingestion of DHA from dietary sources, which particular needs to come from marine fish sources, as omega-3s from alpha-linolenic acid, and shorter omega-3s are not elongated to the DHA EPA in adulthood. So it's important, obviously, to be able to get that DHA source from the specific ingredients, particularly fish. So if we go into just briefly, again, why DHA is important, as I mentioned, it's really critical for brain and eye development, particularly retinal development, because DHA is such a large portion of neuronal tissue and the fat composition in brain tissue. And obviously is very important for nerve cell growth and signaling. But what the research has demonstrated is that DHA ingestion really is critical during the first several months of development, primarily because that's when DHA incorporation is really the most active into the neural tissue. And some of the research that's demonstrated is that when DHA-enriched diets are fed to puppies, it's been really valuable and beneficial to improve and support the learning and trainability of puppies as their learning tests have demonstrated a greater and stronger performance when they've been on diets that have been enriched with DHA. And so this is obviously very valuable to setting them up for a healthy life and proper cognitive development, cognitive function. So in addition, as I had mentioned, DHA enrichment, particularly the enrichment with fish oil to support vision development, can show some research here by Dr. Heinemann. This goes back to 2005. That was also supported by Nestle Purina research, where looking at an assessment of rod thresholds. So you're thinking about the sensitivity of those rod cells to detect light, whether it's light, high light or dark light environment as an indication of vision sensitivity. We have DHA, which as a controlled diet is very low on the far left at a 0.02. You can see incrementally going to the right, you have 0.9% of DHA as the dry matter of the diet, then 0.55. And then there is a omega-3 high alpha-linolenic acid diet to the far right, but is very minimal ability to deliver any DHA because that was only a vegetable oil source diet. And you can see that with regards to vision sensitivity, the lower the bar, the better the sight ability was with regards to in the presence of low light. So clearly you can see that enrichment of the diet with DHA really improved vision performance in these puppies. These puppies, when this test was performed, was 4 months of age or 12 weeks. And what else this study showed is that even in the diets where there was the high alpha-linolenic acid, the bar to the right, even though we did have an improvement that was generally similar to DHA, we do see that there is a low conversion to DHA, and so that conversion effect does start to wane after this 4-month period. So we do get a little bit of benefit there, but that does tend to go away after that 4 months of age. So, but DHA is really the key nutrient here, where we're seeing an improvement in this lower rod threshold, which is interpreted as greater rod sensitivity, which ultimately is associated with better sight ability in a low light environment. So just to briefly summarize, so when we're thinking about DHA in particular for brain health and nutritional enrichment for puppy brain development, we know that that the use of fish oil for the nutrient delivery of DHA is really critical as it supports higher trainability, this better retinal function, which is so important for vision development, which is also associated with a better visual performance in these young puppies. Now, if we move to the other side of the life stage spectrum and we look at how the nutritional management can be approached for older pets, we really want to think about what happens with regards to brain aging. And obviously, there's many things that can occur as the pet ages when it comes to brain function, whether it's behavior, whether it's cognitive function. We know that with aging that there are a variety of changes that occur in the activity rhythms and their sleep cycles. Most significantly is obviously less activity and the desire to sleep more. But that is a little bit different than a more advanced cognitive and severe cognitive impairment where it can really get abnormal activity at odd times of the day, which would be more severe associated activity rhythm and sleep cycle disruption. And then we also see with brain aging, there's a change in brain metabolic rate and which energy substrates are utilized within the brain. And I'll have a little bit of data to share with you with regards to that. And then there's also been research to demonstrate that similar to people, that there is structural deterioration in the brains of dogs related to cognitive impairment in a way that dogs and people will exhibit a lot of similar cognitive changes that's quite reminiscent of changes that are observed in Alzheimer's disease. So to go through some of the cognitive tests that we've performed in collaboration with Dr. Milgram, was originally based out of the University of Toronto in Canada, but now runs CanCog Technologies, and has really been an amazing pioneer in the world of canine cognition research. These cognitive tests, we're looking at an objective way of assessing learning ability. And so this data right here shows a learning task that was used to evaluate dogs across the age spectrum. So you can see on the left, you have young dogs that ranged anywhere from 1 to 8 years. The middle-aged dogs, which is this 6 to 8 years, then 8 to 11, and then senior dogs greater than 11 years old. And what this data represents is actually the number of errors that the dogs performed in this task. Now, this particular task, the dogs had to learn and discriminate an object that was compared between two different objects, but they were the same object differing only in size, which is why this is referred to as a size discrimination task. And so as an example, we put a blue square and then 2 blue squares just to indicate a size differential. And clearly the data shows that as dogs age, they are going to, in this task, perform more errors, indicating that their learning ability does decline with age. And this data has been replicated across a variety of different types of learning tasks, depending on the type of assessment that is being evaluated. So in addition to being able to demonstrate that learning ability declines with age, this data shows work that was published by a separate lab many years ago, back to 1983, showing that the metabolic rate of different regions of the brain will deteriorate with age. In particular, this is glucose metabolic rate, and on the x-axis going in years, going up, starting with puppy or young adult, all the way up to greater than 14 years of age. And clearly we can see that glucose metabolic rate declines as the dog ages. And this is important because when we think about the energy sources that the neurons use, glucose is obviously a very important energetic substrate, in addition to lactate, but also ketones. And that's really where, as a dog ages, we see that there is some evidence to indicate that there's more of a reliance on or need for utilizing ketones to offset this decline in glucose that's used as an energy substrate. And that will become important as we show in the next several slides, the type of research that we demonstrated to show the benefit of how we can deliver ketones to an older dog to support brain health, brain function, brain and cognitive performance. Now, when we think about when brain aging starts to happen, obviously from the data that was just shown, clearly that some of the learning impairment, whether it's a learning task or even memory impairment or other cognitive tests, we can see that some of these declines will start to occur as early as 6 to 7 to 8 years of age. And this is very similar between cats and dogs. And so they both do see this initial decline. And then this is important because this decline starts to happen before we would start to envision or see some of those physical declines that happen with age. And so the value for recognizing this is obviously understanding that it's important to try to act proactively to support the type of nutrients to manage this this cognitive decline that can happen and early normal aging related neurodegeneration, try to slow this process down. Now, when we think about how we have tried to address the cognitive decline from a nutritional perspective, one of the approaches that we took early on, as I had mentioned, trying to look at alternative energy sources to feed the neurons. And so, as I mentioned, the glucose metabolism and metabolic rate goes down with age. And so the nerve cells can have the ability to utilize alternative nutritional sources. And with that one being ketones, one of the ways to deliver ketones to the pet as an alternative to, say, a high-fat diet or being in a metabolically ketogenic state, the other alternative is to feed a diet enriched with medium-chain triglycerides. And so this slide illustrates the metabolic conversion after the ingestion of MCTs, where when the dog will ingest MCTs, they will naturally convert them to ketone bodies, which are then circulating in the blood, which can then feed the brain cells to support neuron activity. Based on this use of MCTs, the colleagues of mine, Dr. Pan and Dr. Larson, also in collaboration with Dr. Milgram and the team at CanCog, demonstrated going back to 2010 that if you feed older dogs an MCT-enriched diet, that there would be a benefit for having cognitive enhancing effects. And that's what this first, I would say, really critical study that we had performed to demonstrate this benefit of leveraging this nutritional approach for helping these older dogs from a cognitive perspective. And so very briefly, I'll share with you the information on how some of these tests were performed. And it goes back to that initial learning task, which is one of the tasks that uses this particular apparatus that's on the right. So with this particular study, the senior dogs were fed for 8 months, and this diet was simply a typical senior diet, chicken and rice based diet that between the test diet and the control diet differed only in the amount of MCT oil that was present, and in particular, the level of MCTs. Lard was the fat that was substituted in the control diet, so it was isocaloric, but it did not contain any MCTs in the control diet. There were a variety of cognitive tests that were performed in this study, and as I had mentioned, it was a way of trying to deliver ketones to the dog through MCTs, and the group had measured ketones in the blood to demonstrate that the ketone bodies were in fact elevated as a result of eating the MCT enriched diet. So to the left, this is what is referred to as the cognitive testing apparatus. And so the test box is a very large crate where the dog enters the test box. To the right, there are slats that the dog can see through. Right here in the middle is this one-way mirror where the dog cannot see through to this opposite side, but the pet care technician that's performing the task with the dog can see the dog. There is a sliding tray, and these are the objects. As I had mentioned in that learning task slide, there was the blue square that differed only in size, and these are the objects that are on the device, whether it is a size discrimination task, where you would have the devices, the items, different sizes, or you would have where you have different devices. I'm sorry, not different devices, different objects. To be able to discriminate one object from a different object, or with regards to different colors, that sort of thing. And so whether there's 2 or whether there's 3, or in some cases, maybe even 4 objects present, the tray has the treat reward that the dog receives for selecting the correct object. And just to be clear for everybody that might not be familiar with this task, the treat reward is in a well underneath the object. And there's a well under every single object, but then under every single object, every object has the exact same food reward under it. So that way the dog is not scenting the reward under the correct object. The scent is uniform across the correct object and the incorrect object. And only by selecting the correct object do they actually get the food reward. So the slide goes back, is presented to the dog. The dog performs the cognitive test by selecting the correct object as per the particular task that's being performed. And then if they correctly select the object, they get the reward. If they incorrectly select the wrong object, it's considered an error, and then obviously they would not get a reward. So that's how this task works. For a memory task, they are presented the objects, but they are not allowed to contact it. Then it's removed for a period of time. And after that period of time, they are then presented the objects again. And so then that duration of time is associated with their memory assessment, as well as the manipulating of the objects. So there's a variety of ways in which this apparatus can be used to assess cognitive function. So again, one of the tasks in this particular study to look at how MCT enrichment impacted cognitive performance. Again, there was in this test, it's what's called a attention task. And the attention, or the selective attention, is associated with the ability of the dog to identify the correct object when there are additional wrong, distracting objects. And that's what the green Lego pieces represent. And so this not only does the pet initially have to learn the task, which is going to differ based on not only color, but also shape of the item and also size of the item. But then they have to then differentiate when more distracting objects become present in the test apparatus. And obviously, you would imagine the more objects that are present, the more distracting it is, the more difficult the task is going to become. And this is the data that demonstrates that with more distractors, the task becomes more difficult. So on the y-axis, there's the number of errors that were performed on average for the different test groups. So we have the control group in this light line, and then the dogs that were fed the MCT enriched diet on the dark gray line. And clearly you can see that there are very few errors when there's only the one blue object present to select. When there is both the blue and the green, more errors are incurred by the control dogs on the control diet. And then clearly, as more objects are added, more incorrect objects are added to distract the pet, the more errors that are performed. But clearly, the dogs that were on the MCT diet perform better across all of the testing conditions. So, which obviously indicates that their ability to have better selective attention. This was one example of one test that was performed during the study. These dogs were also assessed for spatial learning, which was location of the correct object in proximity to a separate object. There was also concept learning, memory, and executive function. Executive function is simply in these instances where they learn a task, but then the correct object or the correct rules are reversed. And so then their ability to quickly recognize that reversal of the correct object and make less errors is an indication of improvement in executive function. So all of these testing conditions to assess cognitive performance were evaluated and all demonstrated an improvement in the dogs that were fed the MCT-enriched diet. And in addition, as I had mentioned, the team had also evaluated ketone bodies in the blood, demonstrating that the older dogs had an enriched level of ketones from that MCTs, which would have then been supportive to help with the nutrition of the brain and neuronal cells. So in brief summary for the aging portion and how we can address the nutritional management, clearly there are many ways that the brain can change with aging. It was important to recognize that these subtle cognitive changes are going to happen quite early, and an opportunity for looking at how we can address earlier intervention with a dietary approach to help reduce these changes over time and help support the pet as they go through those normal brain-related age changes. And also, again, this particular study, all of these dogs were considered cognitively normal. They didn't have cognitively, or I should say clinically they were not clinically diagnosed for cognitive impairment. These were normal age-related cognitive decline effects that the pets were experiencing. And so that's really important, because that then leads to some of the additional research that I'll be showing in the next set of slides, where we start to investigate and look at where pets are truly clinically diagnosed with cognitive impairment. So as I had mentioned, so having demonstrated that first study and the benefit of MCTs and the benefit of nutrients essentially to help support and reduce these indications of cognitive impairment with older pets, at what point would this type of nutritional approach be beneficial for dogs that were clinically diagnosed with canine dysfunction syndrome? And so this is something where we really wanted to move this to a further assessment to where it using this clinical diagnosis that becomes much more meaningful would be more traditionally associated with a true Alzheimer's-like type of condition, where all of these behavioral and much more severe cognitive impairments would manifest to true behavioral changes for the pet in the home. And so that's where this particular study was done, with Dr. Gary Landsberg really being the lead veterinary behaviorist on this trial, again in collaboration with CanCog Technologies. Dr. Pan was the lead scientist from our group supporting this work. And with this nutritional management approach, there was an incorporation not only of the MCT oil into the diet, but also some additional nutrients that were known to have a benefit, which included fish oil, which is listed here, the fish oil, the B vitamins, antioxidants, obviously for supporting and reducing oxidative stress. It's been shown to be very important for aging-related changes with regards to brain health, and then a higher level of arginine to support brain blood flow. And so this is what's referred to as the brain protection blend in the presentation. So I'll be referring to the MCT oil plus the brain protection blend, just to be able to help differentiate the past research, which was just had MCT oil, and this particular study, which was MCT oil plus these additional nutrients. So to give a brief summary of the cognitive decline syndrome study. This study was actually performed in Canada across 24 veterinary clinics that all had pets that were clinically diagnosed with some level of CDS, recruited into the study, and then incorporated into the dietary regimen, whether or not they received a control diet, which did not have the MCTs present, and the brain protection blend levels, nutrients were there, but present at a lower level. Obviously, you can't exclude a normal diet from having any arginine. You can't exclude a controlled diet from having B vitamins. So those were at more of a control level that would be consistent with a senior formula, as opposed to these treatment diets that had not only a higher level of MCTs at the 6.5% or 9%, but the brain protection nutrients that had a higher level of B vitamins, higher level of the arginine, and then the incorporation of the fish oil, as well as the additional antioxidants. So that's how the three treatment groups were separated in this particular study. And the DISHA plus anxiety was the assessment for clinically diagnosing the dogs with CDS. So as you would already be familiar with the DISHA, the disorientation, social interaction assessment questions, the sleep-wake cycle, whether or not there's significant disruption there, the house soiling, learning and memory type of questionnaires that what that pet is experiencing in terms of that particular type of activity, overall general activity of the pet, and then anxiety was also a key component of this. And again, this study was a randomized, double-blind, placebo-controlled trial, so all well-balanced and evaluated at day 30, as well as after 90 days of feeding the diets. So I'm just going to go into the results of the DISHA assessment. So with regards to the controlled diet, we definitely observed a little bit of a placebo effect in this particular trial, in particular where the pet owners were noticing a significant improvement in their sleep-wake disturbance assessment, as well as their house soiling behaviors. Owners were observing a reduction or a lower level at day 30 as well as day 90, and also did indicate a lower level or an improvement in activity. So a lower score. Again, this is the control group, but still seeing significant or no change in the level of disorientation, no change in regards to social interaction, and still similarly seeing a variety of impairment with regards to anxiety. Now, when we move to looking at the impact of the dogs that were on the 6.5% MCT diet plus brain protection blend nutrients, can see that by day 30, 5 out of the 6 DISHA assessment metrics were significantly improved. And this is opposed to, This is opposed to 3 having been significantly improved, as I mentioned, in that placebo effect that was observed there. But then when you go to 90 days, the MCT diet is having a significant improvement in the DISHA score across all of the assessment metrics. So quite significant in terms of the 6.5% MCT diet in particular, being able to aid in these dogs that were mildly and significantly impaired. Clearly having all of these impacted is quite significant, and terms of improving the well-being of these pets that were diagnosed. And so just to briefly summarize, this sharing the data on the 6.5% MCT diet was what was most highlighted here, in particular because we were observing that with the 9% MCT diet on the second bullet point, that the 9% MCTs actually had poor palatability and compliance of feeding that particular diet. So that right there was also very important to understand how by having that higher level of MCT diet, you might be able to get an improvement in cognitive performance, but obviously the pet has to be able to eat the diet. So we weren't able to adequately complete that particular arm of the trial, but really relying on the significance and demonstrating that at this lower level, the 6.5% was quite significant in the ability to improve 5 out of 6 categories by day 30 and all 6 categories by day 90. So reiterating really the earlier findings where demonstrated in the early studies in 2010, where older dogs are having a significant improvement in their objective cognitive testing. And in this study, really going that one step further to say and show that these dogs that are clinically diagnosed are having a significant improvement in these key cognitive assessment parameters. So to summarize in regards to the CDS study, clearly cognitive dysfunction in this particular diagnosis with DISHA is not a normal part of aging. And is quite debilitating to the pet in terms of their relationship with the pet owner and having a lot of additional anxiety that goes along with this level of cognitive impairment. The DISHA tool clearly being a well-validated tool for assessing senior pet cognitive dysfunction, and demonstrating that this particular nutritional blend is very significant in its ability to improve these behavioral signals associated with CDS in dogs. And then the final topic that I wanted to cover is going to be associated with canine epilepsy. And in addition to the nutritional management of pets and brain health related assessment with these older dogs, obviously canine epilepsy and the impact of that can happen at any age. And that's obviously very significant in terms of being able to have a nutritional approach that can assist these dogs that are in particular when clinicians are trying to manage the pets with a variety of anti-epileptic medications and the dogs are still having seizure episodes. So that's one of the reasons that we evaluated this particular line of dietary approach to this issue. Clearly, there's a lot of impact that what comes with quality of life, not only with the pet, but also the quality of life that comes to the pet owner. Unfortunately, premature death is associated with this idiopathic epilepsy as a result of the condition. Many behavioral changes that are observed, and I'll show you a little bit of data associated with that. And then more recently, there's been research coming out of Dr. Volk's lab to show that these dogs with canine idiopathic epilepsy also have a variety of cognitive impairments that exhibit over time. And so all of these factors going into play here, but obviously an opportunity where nutritional management can play a really important role to brain health and addressing the well-being of these particular pets. So where does diet traditionally support or play a role in epilepsy? Originally, using a ketogenic diet was discovered for epilepsy management in the early 1900s to be able to provide this ketogenic metabolism that showed that there was a reduction in seizures. That has been traditionally deployed for the use in young children. And so knowing and being aware that this dietary strategy has had an opportunity for helping children, we started to look at, with our collaborators, the opportunity of also leveraging our nutritional approach of using MCTs to provide a ketogenic substrate to see if this could also have a benefit. And this was this link between understanding what is occurring in epilepsy in the human medical field and applying it to if that could be of benefit to dogs. So the first study that was performed was with Dr. Volk. At the time, he was at the RBC in London. We conducted this randomized placebo-controlled clinical trial with dogs that had refractory idiopathic epilepsy, and just going through some of the data with regards to this. But this particular diet trial was specifically the same diet that was used earlier, with just the MCT oil present in the formula. And as I'd mentioned, working with Dr. Volk, who led and coordinated the study for us at RBC, this was a 6-month-long study, but there was a 3-month feeding phase with then a crossover to the alternative diet for 90 days and 90 days. We had the initial visit, blood sample, and secondary visit at the end of the first phase, and then at visit 3 at the end of the trial. And again, this was the diet that had, but this study had 5.5% MCT in the formula. So very similar to the original cognition research that we published. So there were 21 dogs that were recruited for the study. All of the dogs were being chronically treated with at least one anti-epileptic medication. They were still experiencing at least 3 seizures in the prior 3 months, so still requiring or experiencing instability in their ability to manage the seizure at the level of the anti-epileptic medication. In many cases, there were a variety of dogs that were on 2, and in a few cases, there were some dogs that had a 3rd medication to stabilize. And during the trial, the medication levels were not changed and were maintained at that particular therapeutic level. And we did not see any changes over the course of the study with regards to the blood levels of those anti-epileptic drugs. So no change with regards to that. And I already mentioned the diets between the control and the MCT diet was isocaloric, differed only in the level of MCTs versus a saturated fat or the lard that was used as the alternative fat to make sure that they were isocaloric. So no MCTs in the control diet. So this is the key data that I wanted to share with regards to this particular trial. Is quite significant in terms of our ability to observe pets that had a significant improvement in their seizure frequency. And so this data on the left represents the seizure frequency per month, the placebo diet, number of seizures per month versus the test diet with the MCT, being that there was a very significant reduction in the overall seizure frequency. And if we dive a little bit deeper into what these numbers represent, in that 90-day period, there were, start from the right, there were actually 14% were 3 dogs out of the 21 dogs that were on the trial that became completely seizure-free during that period. And even more significantly is that we had 48% of the dogs on trial that experienced a 50% or greater reduction in their seizure frequency. So a significant improvement in the overall responder rate in terms of these dogs that had the diet that was in conjunction with the use of anti-epileptic medication to help improve their seizure symptoms. Now, there were some pets that did not have a positive response. They did not have any benefit to the diet whatsoever. So still a lot to be learned in terms of how the MCTs are helping to support this particular condition. Obviously, it's very multimodal in terms of the mechanism that's at play here, but in terms of how the MCT diet can play a very significant role in improving the lives of these pets by reducing this seizure frequency is quite interesting. And actually, before I go on, I will indicate that while I'm only presenting one particular study here, this work with the use of MCTs and seizure reduction has been replicated 3 times now in 3 separate studies. And so we're quite confident, and generally the response has been the same every single time, that between 12 to 14% of the pets on trial become seizure-free, and approximately 40 to 50% of the pets on trial will experience a greater than 50% reduction. So it's quite robust in terms of the MCT nutritional strategy, in terms of being able to support a reduction in seizure in these dogs with idiopathic epilepsy. So to just wrap up the presentation, clearly there's a lot of really interesting data with regards to the use of dietary management of an MCT enriched formula to support and improve the efficacy of anti-epileptic drugs with dogs that have idiopathic epilepsy. Just again, to reiterate some of those results, very significant that a variety of pets, up to 14%, can become seizure-free during the 90-day period that they were assessed, with a very significant level of almost half of the dogs having a 50% reduction in their seizures. So very significant in terms of the MCTs to be able to support these pets that are having a challenge being managed with just medication. We were seeing in this particular study that, again, MCT diet does significantly increase beta hydroxybutyrate or ketone levels in the blood. However, the data that was not presented today did not show any correlation of ketone blood levels to seizure reduction. So believe that there's actually a slightly different mechanism in which the MCT diet or the MCTs are having towards improving this condition and reducing seizures. More recently, we've actually published a study to look at some of the metabolomics associated with the blood of these pets, and actually published research to demonstrate that the MCT diet in these epileptic pets are actually having a significant modification on their fat metabolism. And so we believe that there's definitely other mechanisms that the MCTs are having an impact on that's directly related to seizure reduction, that may be working in concert with the ketones, but probably not a direct effect of the ketones, as we believe it is having a direct impact on the improvement for cognitive effects for older pets. So it's interesting there how we believe it's playing slightly different roles in the different conditions. And to wrap up, dogs with idiopathic epilepsy are exhibiting behaviors that do resemble an ADHD-like type behavior symptoms that's similar to what's seen in people, as well as in some of the rodent models. So it's interesting to see that link there, as well as how this diet can improve some of those behaviors as well. which we have shown that the potential to those anxiety reducing types of behaviors like the stranger directed fear. And again, just to reiterate, the MCT diet did not have any impact on the serum level of the drugs that was analyzed in the blood. And with that, I would like to conclude and just thank you for your attention. Clearly, there's many ways that we can use dietary management to support brain health, whether it's with the puppy and early brain development through the use of fish oils to deliver DHA, or with MCTs and other nutrients, in particular with the brain protection blend in those older dogs to support cognitive performance as they age, or to help support therapeutically the dogs that have been diagnosed with cognitive dysfunction. And then obviously these nutrients can impact brain health over the whole lifespan with regards to the evidence that we showed with the condition of epilepsy. So very significant in terms of these different dietary and nutritional management approaches that we can apply in addition to all of the other therapeutic tools that we have available to help support the health of these pets. So with that, I'll conclude. Thank you very much.